We have a safety alert today. A heat wave is coming and certain medications could put you at higher risk for health complications. It's why it's so important to stay hydrated and stay inside if needed. Joining us now is family Dr. Bijoor from Oakview Medical Associates in Greenville. So thank you so much for being here
Thank
today.
you for having me, Kari.
You're also board certified in obesity medicine. So I thought you'd be great to talk to also about GLP-1s. I understand they can actually make you less thirsty. So what is the concern with heat in GLP-1s?
So the GLP-1 medications for obesity and diabetes act by reducing your thirst and reducing your hunger or appetite. They slow the stomach down and send the signal to the brain to not want to eat, basically. So that can be pretty significant. If you forget to hydrate and you forget to eat regularly, you can get dehydrated pretty easily, especially in the hot weather that's coming up. Also, they can cause nausea, vomiting, diarrhea. So some of the symptoms can potentiate dehydration and heat cramps and all the other, negatives that we see during this hot weather.
So if you're on a GLP-1, would you recommend also having electrolytes if you're outside during this weather?
Yes, that's really important to stay well hydrated and just to keep it on schedule, because it's hard to rely on your thirst mechanism, which is not kicking in on these medicines. So every hour, just be mindful to try to sip, at least maybe half a glass of water, and then add 1 electrolyte packet per day. Okay. That would be pretty easy.
Good tips. What other medications could put you at risk?
So blood pressure medications are pretty significant. They're diuretics, so they make you lose urine and sodium anyway, so that can worsen dehydration. Beta blockers can slow the heart rate down, so they can effectively kind of reduce your mechanism of keeping your blood pressure up when you're dehydrated. Also, antihistamines is a big one. We always take Benadryl, cough medication over the counter without realizing they can actually dry our system out, dryness of the mouth, and they also can impair the thirst mechanism. Then some of the antipsychotics, ADD medicines, they also are known to create more heat in the body and disturb the thermoregulation. So what you don't sense the fact that you need to cool down. So if your body gets overheated and the cooling mechanism is impaired, that can lead to further dehydration, confusion, dizziness on these medicines. And the most important for elderly are the bladder medications. Some of the, for example, Detrol, oxybutynin, they can get our elderly patients pretty confused easily because they get dehydrated and they just cannot manage thirst.
Yeah. I was surprised with the antihistamines. I didn't know
That's
that
right.
one because my son takes those sometimes.
Yes,
so
it's important to schedule your hydration and intake.
Okay, and making sure my son is drinking if he's on one of those. What about leaving medications in the car? That's
pretty dangerous because firstly, the temperatures can go up to 140 degrees Fahrenheit to the medications. Actually, they can get pretty heated, which can make them less effective or ineffective. It can also impair our body's ability to fight or to cool down if you take medications that are disturbed like that. You also want to make sure that when you're in the hot environment outside that you wear cool clothes, comfortable clothing, and hydrate regularly. I think that's one of the main things we need to remember. More important than how hot is it going to be, we have to start thinking, what are my medications and what are my medical conditions and how can I best manage that when I'm out enjoying this beautiful 4th of July weekend.
But sipping every 30 minutes, that's good to know. Okay, thank you so much for breaking all that down.
You're welcome. Thank you.